We have already discussed about what is dysarthria in the last video. So today we are going to look into the topic, the different types of dysarthria. Dysarthria can be congenital, like in cerebral palsy, or acquired. So this can be classified into different types: spastic dysarthria, flaccid dysarthria, hyperkinetic dysarthria, hypokinetic dysarthria, ataxic dysarthria, unilateral upper motor neuron dysarthria, or mixed dysarthria. So let's begin with spastic dysarthria. In spastic dysarthria, the lesion occurs in the upper motor neuron. So this includes the pyramidal and extrapyramidal tracts, and the primary deficit involves in the muscle control, or there will be spasticity, which includes the muscle rigidity. So next, let's look into flaccid dysarthria. In flaccid dysarthria, the lesion occurs in the lower motor neuron, and the primary characteristics is muscle weakness, which is called as hypotonia. Now let's look into hyperkinetic dysarthria and hypokinetic dysarthria. In hyperkinetic dysarthria, the damage occurs in the basal ganglia and the primary deficit is in involuntary movement. So this can include neurological conditions like chorea, myoclonus, and also Tourette syndrome. So now let's look into the topic of hypokinetic dysarthria. In hypokinetic dysarthria, this can include reduced movement, and these can include the neurological condition of Parkinsonism. Now, what is ataxic dysarthria? In ataxic dysarthria, the primary deficit will be in coordination and the damage will be in the cerebellum and the cerebellar units. Now, what is unilateral upper motor neuron dysarthria? As the name shows, the lesion will be in the upper motor neuron pathway and it can be in either one of them. It can damage the upper motor neuron pathway that carry impulses to the cranial and spinal nerves which supply the speech muscles. Now, what is mixed dysarthria? In mixed dysarthria, it can show a combination of more than 2 or 3 types of dysarthria, as in neurological conditions like amyotrophic lateral sclerosis, which show a combination of spastic and flaccid, or in multiple sclerosis and Wilson's disease, etc.